Okay, good morning, everyone, and welcome to PCF's new practical and informal series about prostate cancer for patients, survivors, and families. Our first guest today is the amazing Alicia Morgans from Northwestern University. Hi, Alicia.
Hi, thank you so much for inviting me here.
She is an MD, Master's in Public Health oncologist, and two-time PCF grant awardee. Today, we're going to talk about very practical information for patients related to COVID-19. We're going to jump right in with some questions about prostate cancer. If you're in the audience and you're interested in general information about the coronavirus, go to pcf.org/COVID-19 and you'll find a big list of resources, including the CDC's website. But today, we're going to talk about prostate cancer. So Alicia, this can be a terribly hard and confusing time for prostate cancer patients and their families. So in general, just start with, what are the primary pieces of advice and information that you'd give to a patient in terms of how this is going to change their next few months? How can they work with doctors to be a partner in their own care?
So I think there are a lot of levels actually where patients can go right or can go wrong when it comes to COVID-19 and prostate cancer. The first I would just say is if you're on this website, it means that you have either an interest in prostate cancer, you yourself have prostate cancer, you're a loved one of someone with prostate cancer, or actually maybe you're just curious about prostate cancer. Prostate cancer screening needs to continue despite COVID-19. If you're having urinary symptoms, if you are of age where you should be getting at least a conversation about a PSA or undergoing screening with your doctor, you need to do that. Because although we can diagnose early stage prostate cancer and we can cure it, we do not yet have a cure for advanced metastatic prostate cancer. So that's one main message, that I do worry that because of this incredible health scare and incredible health situation, which is not just a scare, but is a reality, that people will not get screened for prostate cancer or deal with the symptoms that they do have. And so that is something to think about. If you have prostate cancer, it's really important to have a conversation with your doctor, with your physician team, with your nursing team, all of your clinicians, to understand how urgent and emergent it is for you to come into the hospital. Because one of the main things that we're doing in our clinic is trying to delay or push back any non-emergent visit for patients, as long as that's medically safe. And we are certainly providing all of the treatments that are absolutely necessary for patients. But one of the main things that we can do when we think about the overlap of prostate cancer and COVID-19 is prevent people from coming into a hospital situation when they don't need to and potentially being exposed to COVID-19.
Right, that makes sense.
Absolutely. So, and just to mention, we know that men with prostate cancer are usually going to be older, and this population is the population that is most hard hit in terms of potentially needing the ICU or potentially having a death related to COVID-19. So it is especially important in the prostate cancer population.
So when patients call their doctors, talk to their doctors, or even get to the clinic or the hospital, what changes can they expect to see in the medical system and in the way that they interact with their medical providers?
So in our clinic, as in many clinics, we're actually converting as much as possible to telehealth, which means that patients, when they need them, are going for labs, potentially in our clinics or potentially at a local lab facility, and then having that information sent to their physicians. And then I'm calling people on the telephone by schedule. So people are still on my schedule and I still have a time when I'm supposed to contact them, but I'm going through everything that I can on the phone. So that is a major difference. There's not the normal laying on of hands, listening to heart and lungs, doing a physical exam, all of that. But what we still hope to have is that connection where patients share with their doctors the experiences that they're having, if they're having new pain, if they're having new weakness, fatigue, or other complications that could be related to the cancer or to the treatment, that all needs to be communicated. But the main thing is that we're trying to do as much as possible from a distance, recognizing that we need to keep people safe and still doing labs and exams when necessary, but otherwise trying to keep people out of the hospital.
Right, that makes a whole lot of sense. If you're already scheduled for treatment, what things do you recommend that patients ask their doctors? Like, what specific questions should they ask when they call?
So that's a great question. One, can my treatment be delayed? Or two, can my treatment be given in a way that I maybe have my GnRH agonist or antagonist injection and then still do my telehealth appointment with my doctor, which is something that a lot of people are doing. Some folks are talking about using longer acting GnRH agonist therapy. So we can give a dose that lasts for 3 months or maybe 4 months, and those are used really commonly, but there's also a 6-month formulation, and maybe that's the way to go. Or some people are even considering having surgical bilateral orchiectomy to really negate the need to come in on a regular basis for their injections. So that's one thing. But there are other treatments, things like different pills or certainly chemotherapies, where you actually definitely need to have lab work. And for chemotherapy, for example, because that's an intravenous infusion or something like radium or sipuleucel-T, you need to be there in person. So asking the physician team, can I delay this therapy? Is there an alternative to an intravenous therapy that I could use in the short run while we're dealing with this pandemic? These are really important questions. And if I'm on chemotherapy, because many men need to be on chemotherapy, are there ways that I can avoid the severe complications that one could have with the COVID-19 virus in the setting of being immunocompromised on chemotherapy?
Right. So talk specifically about that, especially for men in radiation and chemotherapy. We hear a lot that COVID-19 is a real risk factor for people with compromised immune systems. So talk about that in the context of prostate cancer and immunity specifically.
So I'm happy to, but I would say that we don't have a lot of experience with this specific interaction. So what I'm saying is general advice and not advice from patients that I've treated at this point who have developed COVID-19. And I think that the only information we have for patients who have active cancer and who are in active treatments, which I assume is probably chemotherapy, comes out of China. So we're in a different population, is not necessarily a prostate cancer population. I think actually most of them are not, if not all of them are not prostate cancer patients. And we know that those patients had poor outcomes in terms of more patients ending up in the ICUs and more fatalities. So that's the only real information we have, and it's scant and it's not specific to prostate cancer. So what am I telling patients? It's really just based on best practices. Stay away from other people. Do your best to wash your hands always. And if you can, stay in your house and have someone else do the grocery shopping. Wipe down all the groceries that you bring in before they're put away in your cabinets before you may engage with them. And we don't yet have any recommendation or guidance about masks and going out in public and doing those kinds of things and using any protective equipment for people who are not clinical people who are engaging with patients. So I can't advise along those lines, but I would just say staying away from other people is really going to be the most important thing. And then if you have any symptoms, to reach out to your doctor right away, because it looks like people can have a period of being relatively well adapted to the virus and to the infection, before after a number of days, they have sort of a plummet or a decline that seems rather rapid after they've been doing okay, and then they can have a sudden decline. So if you have any symptoms at the first sign, call your doctor. Say, should I get tested? If I should, where should I get tested in my area for COVID-19? And try to make sure that those lines of communication are open so that if you do have a rapid decline, you know what to do and where to go in terms of the hospital or the emergency department or some urgent triage for your oncology clinic.
Yeah, that is great. Amazing recommendations right there. So, talk a little bit about active surveillance and how, what role it can play for men with low risk disease and who might be, sort of eligible to go on to active surveillance.
So I think active surveillance is a really, really attractive way to treat prostate cancer generally, but so much more even in the setting of COVID-19. Active surveillance is a great option for people who have low and very low risk prostate cancer, who are really good at following up in terms of having their PSAs checked. And then each clinical care setting usually has its own active surveillance guideline or routine that they follow in terms of how often they'll do biopsies and those kinds of things. But these are men who have low risk localized prostate cancer based on what the pathologist has seen under the microscope, and who have low PSAs and who are good at following up and good at following directions, essentially come back to the clinic and see their doctor, or in this setting probably at least have a PSA check so that they can have a biopsy or treatment if necessary, but can delay or defer treatment like radiation or surgery until it is necessary. So when we're trying to limit people's exposure to the healthcare system, but certainly still understand if they have prostate cancer and monitor them to understand if it becomes a more grave problem, this is a perfect way to try to help take care of men who have low and very low risk prostate cancer with minimal exposure to the healthcare system and minimal risk in terms of COVID-19.
That's great. And I'm just going to reiterate what you said earlier. People who are in active surveillance are going to need to go in and get their PSA checked.
Absolutely. If not to the clinic, maybe to a laboratory that will then fax those results to the clinical setting. So this is different than watchful waiting, which is a strategy of really knowing that you have prostate cancer and choosing not to treat it and not to follow it with lab work, not to follow it with physical exams, and not to do anything. So this is actually a strategic and well-defined plan of follow-up, including laboratory testing to assess and monitor PSA over time. And there are built-in times at which we would then also have another biopsy of the prostate to make sure that we understand if the disease is becoming more advanced or needs to be treated.
Let's talk about the other end of the spectrum. As a man with metastatic disease, this is probably an extremely, extremely stressful time. What do you recommend in terms of coming up with a plan with their physician?
So again, this is a time to think about all of the options that we have for treatment, and we're very fortunate to have multiple options for treatment in the metastatic setting, both in the hormone sensitive or castrate sensitive setting, as well as in the castration resistant setting. And so a conversation with one's doctor about what I need to do, what are all of my options, how tied must I be to something that's going to be more immunosuppressive or something that will require intravenous infusion and frequent visits to the doctor and frequent lab work, versus how available to me are options that I can take either perhaps orally or options where I have fewer lab visits, fewer engagements with the hospital system. This does not mean that you would not have follow-up. This would be telehealth, as I said before, but just understanding what can I do to avoid things that could be harmful in the short term while really dealing with this potential surge of COVID-19 as a pandemic right now, that we could then delay to do in 6 months or in a year or at some later time point. Because ultimately, men with advanced metastatic prostate cancer need to have access to all of these treatments. It will happen. We just need to keep you well enough to get all of these treatments. And so sequencing them in a way that minimizes low immune systems now and allows you to get those treatments that lower the immune system in the future when COVID-19 hopefully is a thing that we remember but don't have to deal with on a daily basis, will really be beneficial to people with advanced disease.
Yeah, great. Another amazing answer. So we did a Facebook Live with Jonathan Simons, our CEO, last week. And interestingly, we found that a lot of the audience was caregivers. And so this question sort of comes directly from our audience. And I'm going to read it. I've heard that hospitals are not allowing anyone to come with patients to appointments. I always go with my husband because he gets confused about all the details, and I keep careful notes. How can caregivers be supportive given these new rules?
That's a wonderful question, because I think that one of the strengths of the prostate cancer community is the strength of the caregiver community that really helps be with them all the time in these visits, and certainly on a day-to-day basis as they deal with the realities of taking care of a person with prostate cancer. So thank you for the question, and I really acknowledge that it is incredibly important for you and for your loved one. So the best way I think to do this, because this is actually, as of 2 days ago, become a rule in our clinical setting, and may be the case in many places across the country. It is true that caregivers are not allowed to come into visits right now, for us at least. And again, as I said, for many places across the country. So what can we do? Well, we can use technology. And I think that one of the amazing things that we have are things like FaceTime or other video conferencing tools that we can put onto people's cell phones. We can, at a minimum, ask the physician to use the speakerphone in the visit and call from the visit to your phone if you're the caregiver who wants to participate. And if there is other technology within that physician's office or on the computer, things like Zoom or Microsoft Teams or something else that the healthcare physician community within that center allows you to use, because it has to be HIPAA compliant if it's through the computer in many instances, then use it. But at a minimum, if your loved one has FaceTime or something similar as an app on their telephone, and you do too, then you can have yourself propped up in the clinic room so you can see the physician and see your loved one, and be on the other end and even see what's going on and certainly hear it. If that does not work, then a speakerphone is still an option. Old technology, but it works, and you can know when you're going to have that conversation and be on the phone. And stay ready with your notebook, because we still need you to take those notes. We still need to be on top of everything. We don't want care to be compromised because of COVID-19, but we do need to keep everybody safe.
Yeah. So because it's such a hard time right now, as someone who's on the front lines, what words of hope can you offer to patients and their families at this extraordinarily difficult time?
I would say that hope is absolutely out there, and hope is what I think about every day. We are still making amazing strides to care for people with prostate cancer. There are so many treatments that I see in the very short term that are coming down the pipeline or hopefully about to be FDA approved that we'll be able to use to help men live longer and to feel better. And right now we have a bit of a bump in the road. This is a problem, a real problem. But I think that by using our minds and by using best practices and with our loved ones, keeping everyone we know safe, we can absolutely get to the other side. So hope that we can take care of your prostate cancer and keep you and your family safe while we keep our clinical team safe too is absolutely what I think about every day. And we can always cling to it because it's right there. And we're making, as I said, great strides each day. PCF is a huge part of that. And I still am very grateful to be a part of this community, to take care of people with prostate cancer. Even with COVID-19, we're doing great things.
Well, you know, that was going to be my next statement after listening to everything you had to say, which is how grateful I am for you and all of our doctors in our network. We both have our Prostate Cancer Foundation attire on today. And I want to ask you, you know, I know you do a lot of interviews with doctors for Euro Today. And if there's anyone that you're really interested in interviewing who you think you might be great, not just for doctors, but directly to patients, like who are some of those people?
Absolutely. So some of these folks I have interviewed already and some I have not, but one who I would love to hear from, always gives such a balanced perspective, is Dr. Michael Norris in New York. He is at Memorial Sloan Kettering, is a wonderful physician and a great leader of the GU group and the Alliance, one of our clinical trials organizations, and is phenomenal. And one of the others that I'd love to hear from that I haven't yet talked to is Dr. Tanya Dorff, who's at City of Hope. Mm-hmm. She is really pushing the envelope with a lot of research initiatives, including CAR-T. And I would love to talk to her about where things stand with her research and with her clinical care, being in California and really in an area that is hard hit as well.
Well, those are two excellent choices. So we're going to try to set that up. So hopefully next time we can have you interview one of them. And what we'd like to ask our audience to do is, hopefully this was helpful for you. We're glad to be able to do it. And if you want to leave in the comments any questions that you might have when Alicia comes back with the next interview, hopefully we'll be able to ask some of those questions. Alicia, thank you so much. I know that, you know, it's tough times out on the front lines, and we're so grateful that you took the time to be here with us today and to give this great information. As always, patients out there, go to pcf.org for more information. Go to pcf.org/COVID-19 for specific information. Alicia, thank you again.
Thank you. Thank you so much for the opportunity, and thank you to PCF for continuing to support our community in everything and anything, including COVID-19.
Thanks, everyone.